Before I start my topic, just some small trivia. The term robot came from the Czech word robota, meaning forced labor or activity. And in 1920, Karel Čapek, a Czech playwright, wrote a science fiction play called Rozum's Universal Robots, where robots were a series of factory-manufactured artificial people that undertook ordinary tasks for their human masters. So it was like for ordinary tasks. So I felt it really funny. And the first robotic surgery was performed in 1988, which was for neurosurgical biopsies. And today in 2022, we have a lot of robotic systems and we're discussing about that. Now, what do we mean by an imageless system? So we saw a CT-based system, and I believe you saw the presentation earlier where somebody else is planning and somebody else is executing. So in imageless system, you don't need to do any pre-op CT or any MRI, but that means that you're doing some intra-op mapping of the patient's bones, also of the alignment, and giving the information during the surgery. So imageless system is totally surgeon dependent. And I believe as a surgeon, you would like to be in control of the whole system, of the whole surgery, and the main person who is doing the surgery, and not a technician telling you what to do. So surgeon controlled handheld intelligence for modern robotic approach. It's image free, smart mapping, real-time planning and gap assessment, and optimized alignment and balance. And of course you can see that's the Cori system from Smith & Nephew. It has got a faster, swifter and precise checkpoint registration. Also, the camera is very fast, almost 500% faster than the old one. So you hardly take a minute or two to finish off with your registration. So smarter image-free mapping, handheld robotic system allows surgeon to control and map the femur and tibia precisely in real time. So you have to give the information as a surgeon to the robot, whatever you feel is necessary. So it's as per the surgeon's preference. You want the transepicondylar axis, you want the posterior condylar axis, you want the white sides line, whatever preference you have as a surgeon for your rotation, whatever extra you want to give, you can give to the robot and then decide and make a plan as per your preferences. So significance of an image-free robotic system, it's a real-time imaging in the OR. So it eliminates time cost. It also reduces radiation exposure because there's no need of a pre-op CT imaging. Eliminates pre-op logistics of surgeon and staff because you see in a CT or a CT-guided robotic system, you are spending almost more time outside the OT rather than inside the OT. And as a surgeon, I believe we would rather spend more time in the OT rather than spending time outside the OT like a radiologist in the CT room. With the state-of-the-art software, intraoperative 3D model is created based on patient's anatomy. And real-time fast gap assessment with precise implant planning. So these are the advantages of an image-free robotic system. Now, enhanced robotic knee workflow. So this is a portable handheld robotic system which has one of the smallest footprints in orthopedic systems today. It's got improved ergonomics, delivers 2x fast cutting volume, 29% faster resection, 2x longer throw for easier posterior resection, and a pistol grip for a more natural hand position. And that's, I would say, a progression from the old system, which helps. It's very much ergonomic for the surgeon. You can use the burr for a longer time without getting cramps in your hands. So benefits of a handheld robotic system. So you can see that this has got so it has got a 180-degree rotating array, so that increases the visibility of your handheld robotic system. There is a dedicated suction for high visibility, so whenever you're burring, the bone dust doesn't come in way of your visibility. There is an integrated irrigation system, so you can keep the temperature of the bone low and there is no bone necrosis while you're burring the bone. It is much more efficient from what it was earlier. There is an integrated soft tissue balancing software. And you did see Dr. Rishikesh Saraf's videos where he had shown how he's balancing his system. So with this system, I say you can do intelligent alignment. And that is as per what you think is right for the patient and the way your philosophy of aligning the knee is. See, because what is perfect, I don't think we have still reached that thing about what is a perfect total knee replacement. And I believe it varies from a patient to patient. You can't just make a generalization that this is the perfect thing for every knee that you're operating. And this robotic system gives you this modularity of changing the implant size, changing the position of the implant. It also gives you an idea of how much release you want to do. And all this is real time. So it's not done anything pre-op, it's all during the surgery. It makes you think faster, makes you think what you want to do and what you want to achieve. So that is why I said this system gives you an intelligent alignment, a mix of whatever you want, a gap balancing system, or you're a measured resection guy, whatever is your surgeon preference. There is more efficient resection of bones, cuts more in less time. There is a milling technique, and there are different techniques which you can use with this system. All burr requires much fewer instruments. Now this is the comparison of all the available robots. That's the Mako robotic system where you need a CT guided, you need to make a 3D model. So you make a 3D model, again during surgery you need to again point those pointers of the CT. So I think you are wasting quite a bit of time pre-op, intra-op also. Then cutting is done with the saw. It's a non-mobile huge console. Navio or Cori handheld robotic system, it's a compact design, 10-second calibration, that's it, it takes during the surgery, it's a fast process. It's completely surgeon controlled, and that is what I feel is very important for us as surgeons. It's up to you what you want to do and how much time, where you want to spend. It's image-free, real-time planning, easily portable from OT to OT, or rather from a facility to another facility also. ROSA, again, CT landmark calibration or calibrated X-rays for intraoperative planning based on 2D to 3D X-ray planning, CT-based system, non-mobile huge console, and a technician is required. QVIS robotic system, again, CT-guided 3D image, pre-op planning, bone motion monitor function detect intra-op patient bone movement. So there is something which detects the movement of the bone, and if there something goes wrong, the whole surgery can go wrong. Saw and selected region automatic cutting, tracker array attached to OT table, movement may cause interference with planning, non-mobile, huge console, and technician required. So I believe of all the systems, the handheld image-free one is a totally surgeon-centric, without a technician system, and I believe it gives you a lot of room for doing a lot of things as per your preference. So it's a portable cart from OR to OR. It's got a transportation case which you can move from one hospital to the other also. Thank you.